Hi, this is Dr. Pravin Patil. I am a rheumatologist working in Pune. I am also medical advisor and founder member for Ankylosing Spondylitis Welfare Society. I would like to thank Novartis Fight the Fuse and Back the Fight campaign for helping us in disseminating this medical information among the patients with ankylosing spondylitis. Let's learn about these terminologies. First one is axial spondyloarthritis. Here, axial refers to the joints of the spine, chest bone, shoulder, and hips. Axial spondyloarthritis is an umbrella term. It includes two entities. One is non-radiographic axial spondyloarthritis, and other one is radiographic spondyloarthritis, which is also called as ankylosing spondylitis. So we all are familiar with ankylosing spondylitis. The definition of ankylosing spondylitis is based on pre-MRI era, which means that time X-rays were available to make the diagnosis of ankylosing spondylitis. With the popular use of MRI scan, a new entity got recognition, which is called non-radiographic spondyloarthritis. So non-radiographic axial spondyloarthritis. In these patients, they have symptoms similar to ankylosing spondylitis. However, they do not have changes which are easily seen on X-rays. So these patients may have changes or the inflammation visible on MRI scan. So technically speaking, there are no differences in symptoms between non-radiographic AxSpA and AS. On an average, the loss of function and the work impairment is similar between these two groups. However, patients who have high level of CRP or high degree of inflammation on MRI scan, particularly male patients, are at risk of developing from non-radiographic AxSpA to ankylosing spondylitis. However, the treatment does not change between these two groups. So let's understand about spinal fusion. Spinal fusion is by far the most feared complication of ankylosing spondylitis. However, it is potentially avoidable. AS can cause some of the bones in the spine, that is vertebrae, to fuse. This fusing makes spine less flexible and can result in hunchback posture. The spine's vertebral bodies gradually develop a square-like shape. As AS progresses, the fibrous tissue and ligaments ossify, meaning they gradually turn into bone. The joints of the spine lose their cartilage and eventually fuse into solid, unmovable masses. In some instances, the spine may appear like a bamboo, hence it is called as bamboo spine. Around 25% of AS patients can develop bamboo spine. Spinal fusion does affect quality of life by severely limiting mobility. Simple things like eating or dressing up becomes very difficult. Spinal fusion can compromise the health of the rest of your body as well. If there is a kyphosis, which is the hunchback posture, the internal organs become squished. The breathing capacity is diminished and it can even impair the heart function. So let's understand about the symptoms of ankylosing spondylitis. So back pain is an important symptom. As you know, 9 out of 10 people will experience back pain sometime in their life. However, the back pain of ankylosing spondylitis is little different. It is called as inflammatory back pain. It is slow or gradual in onset. It comes over weeks or months compared to sudden back pain which appears in other mechanical causes like slip disc. So early morning stiffness and pain is an important symptom of inflammatory back pain. So it wears off or reduces during the day or with exercise. However, first thing in the morning, patients find it difficult to get out of the bed and it can last for more than 30 minutes. These symptoms usually remain in ankylosing spondylitis patients for more than 3 months. If we have back pain which lasts for less than 3 months, then there could be some other reason for that type of back pain. Patients with ankylosing spondylitis feel better with exercise and the symptoms are worse with rest. Pain in a buttock is an important symptom which many patients with ankylosing spondylitis experience, and the buttock pain can be alternating in nature. Patients go through good and bad days. Some days they feel really good, and some days are really worse. Patients can even experience ribcage pain, which is worse on sneezing or coughing. Weight loss can be seen particularly in the early stages of the disease. Fatigue and tiredness is a underreported symptom. However, many patients have very troublesome fatigue, which affects their quality of life. So, apart from spine, a patient with AS should be aware that AS can affect other joints like knees, ankles, shoulders. So, it affects large joints particularly. Hip joints are involved in around 30% patients with ankylosing spondylitis. Severe cases require total hip replacement. Early detection of hip joint involvement is important to prevent the deterioration of hip joints. AS can affect other organs. Eye involvement is seen in around 30 to 40% patients with ankylosing spondylitis. If you are having redness in the eyes, painful or blood vision, then you should visit eye specialist. As you are aware that AS can affect skin, which is referred to as psoriasis. The skin disease associated with AS is called psoriasis, and it can cause intestinal problems, which are called inflammatory bowel disease, Crohn's disease, or ulcerative colitis are the examples of AS associated inflammatory bowel disease. Knowing about these extra-articular features of AS is important. In these patients, timely involvement of relevant experts can help to reduce the organ damage. Okay, so we are going to learn about fatigue. Fatigue is an important symptom in patients with chronic inflammatory diseases like ankylosing spondylitis. We don't have any specific drugs that would target fatigue, so it is very important for patients to learn other lifestyle measures to reduce fatigue. Long-term pain wears the body down, leading to feeling of fatigue. Sleepless nights and stress adds to fatigue and tiredness. Fatigue can be due to other causes like concomitant medical illness, thyroid, anemia, or nutritional deficiencies. So, to manage fatigue, I advise my patients to learn relaxation technique. This can help to reduce mental stress and fatigue. Regular exercises has been proved to reduce feeling of fatigue in patients with ankylosing spondylitis. We cannot emphasize enough about the importance of good night's sleep. Taking adequate measures for nutritional deficiencies like vitamin D or vitamin B12 supplements can have significant impact on this symptom. Patients should be screened for other medical diseases like anemia and thyroid. I encourage all my patients to discuss these important symptoms during their follow-up visit with the rheumatologist. Okay, so we are going to discuss about the disease progression. First, let's answer how do we measure the disease activity. So, BASDAI and BASFI are the important tools. These are patient-reported outcome tools, and the rising score of BASDAI and BASFI can indicate that the disease is not well controlled. Many patients ask for X-rays to look for disease progression. However, X-rays are not very good for monitoring disease progression. They are slow to show any significant change. It takes around 2 years to be able to see any significant change on X-rays. Lab tests like ESR and CRP indicates level of inflammation. Poor clinical response, that is, patient's pain is not under control, worsening of deformities, or limitation in daily activities indicates that disease is progressing. I recommend yearly physical measurements for limitation in your range of movement activities. A physiotherapist can help. For example, they can measure how much you can bend forward, the distance between ear and wall, and all these measurements can be tracked on yearly basis. Untreated ankylosing spondylitis can cause irreversible deformities in the spine, which is called as kyphosis. Limited chest expansion can cause shortness of breath on minimal exertion. Wear and tear in hip joints results in osteoarthritis of the hip, and this can require total hip replacement in some patients. Remember, around 30% patients will develop hip osteoarthritis. Increased cardiovascular risk is another complication of long-term ankylosing spondylitis. This means that patients with ankylosing spondylitis are at high risk of getting heart attack or strokes at a young age. This is due to the spillover of inflammation in the blood vessels. Osteoporosis. Osteoporosis means thinning of bones. Chronic inflammation in AS can cause loss in bone density, and these patients are more prone to get fractures even with trivial trauma. In rare cases, ankylosing spondylitis can affect heart, kidney, or lungs. Fortunately, these complications are rare these days. This may be due to better diagnostic techniques and the recent advances in the treatment. Fusion is the most feared and potentially avoidable complication. Remember, not everyone with AS will get spinal fusion. There is no way of knowing which of the AS patients will develop fusion in the spine in 10 years' time. Some people are at high risk, like those who are smokers, those who had late diagnosis, or had high disease activity or high level of damage at the time of presentation to a rheumatologist. Even overweight patients are at high risk of developing spinal fusion. But we assume that every patient is going to develop fusion. Hence, we are carefully monitoring each and every patient. Regular treatment with rheumatologist and daily exercise can help in big way to reduce the probability of getting spinal fusion. So many patients ask that what's their role in stopping disease progression. So I tell them that the disease is partly under your control. First thing is, if you are a smoker, you should stop smoking. You have to quit smoking altogether. Cutting number of cigarettes doesn't work. Medical help is available in the form of smoking cessation clinics, and they provide like nicotine chewing gums or counseling. Daily exercise is important, and here I would like to emphasize that continuity is more important than the type of exercise. A physiotherapist can help you to find a good exercise routine. Third important thing is getting involved in decision making. I find many patients leave it to their family members to find solution for their health problem. You should decide the best suitable treatment for you with your rheumatologist. Taking regular medication and having regular follow-up with one rheumatologist, that is long-term follow-up, can help to plan a long-term treatment. Many patients keep changing doctors, and hence their care get divided. Obesity or being overweight is a risk factor for disease progression. Maintaining healthy weight by following balanced diet plays significant role in your treatment. So we are going to learn about the treatment options in ankylosing spondylitis. Stopping smoking and regular exercises are main part of treatment. I include these two here rather than in the lifestyle changes, because these are not just general health advice in the context of AS. Physiotherapy plays a vital role in the management of AS. Pharmacological treatment options include NSAIDs or anti-inflammatory painkillers. Continuous use is more important. Studies have shown that on-demand use of this medication does not help to stop disease progression. So these are not simple painkillers. NSAIDs have disease-modifying properties and they stop new bone formation. DMARDs, which is disease-modifying drugs, is used to reduce spinal stiffness. So biologics is the new form of drugs we are going to talk more about in the later session, but they are available in the form of injections. There are two types of biologics. Remember, everyone doesn't need biologic medications. It all depends on the stage and severity of your disease. So these are the treatment options available for patients with ankylosing spondylitis. So biologics are relatively new form of drugs. Just like antibiotics, which is a class of drug, similarly biologics is a class of drug. and they are available since 1999. So they are not a research molecule, they are part of our standard care. Biologics target specific components of your immune system, and that's how they reduce the inflammation. Biologics are derived from living organisms or they are produced by cutting edge biotechnology. Hence, they are called biologics. They are complex proteins, they are not simple chemicals like paracetamol. They work very well, but they are relatively more expensive. High cost is due to the manufacturing process required for this complex protein. It is a myth among patients that these drugs are expensive, means they are more powerful, and strong medication means they will have more side effects. Of course, it is not true. Biologics should be used way before the deformities occur because it can have life-changing impact on patient's life. Yes, biologics can cause side effects, but most of the side effects are avoidable with proper precautions and screening for diseases like tuberculosis and hepatitis. Compared to the traditional disease modifying drugs, biologics do not affect liver or kidneys, and their long term use is safe. Biologics is not one fit for all. Biologics should be prescribed by a rheumatologist who has enough experience and knowledge about the illness and use of biologics in ankylosing spondylitis. So, prevention or delay of spinal fusion is the main goal of treatment of ankylosing spondylitis. NSAIDs have shown that they reduce disease progression and even reduces new bone formation. Biologics initial studies gave conflicting results. However, the recent data has proven that biologics do help in slowing down disease progression if patients take it for adequate duration of time. In fact, there is a study which showed that 10 years delay of biologics therapy is associated with disease progression compared to patients who received the biologics therapy earlier. The importance of exercise cannot be overemphasized. Patients who take biologics therapy in combination with exercise do better than taking biologics therapy alone. So remember, it is possible to prevent the spinal fusion if you have regular monitoring and regular treatment with your rheumatologist. So biologics are considered second-line treatment. Many patients with AS do not need biologics because their disease can be managed with NSAIDs and physiotherapy. Treatment with biologics is reserved for patients whose disease is not under control even after taking few weeks of NSAIDs and physiotherapy. Biologics therapy is used with the aim of preventing, delaying long-term debilitating effects of the disease, which is spinal fusion, and improving quality of life. Biologics should be used early in the course of the disease. Remember, it cannot reverse the deformities. So biologics can control damage if we use the biologics for significant duration of time. Taking it just for 1 or 2 months is not useful. So yes, they are there to help and stop disease progression. However, they should be used at the appropriate time and much before the deformities set in. So patient often ask me, can they stop treatment if they do not have symptoms? So stopping treatment should be discussed with your doctor. If one form of medication doesn't suit you, then your doctor can help you with few other options. But stopping treatment without discussing your doctor can be dangerous. Remember, studies have shown that continuous use of medication has the disease modifying property, not the on-demand use. You may get symptom control, but your disease can progress in that situation. It is possible to stop medications, but this decision should be taken by your doctor, and they will take into account not just the pain but also other parameters like level of inflammation in the blood in the form of ESR and CRP. So it is important that you continue treatment in consultation with your rheumatologist. So regular treatment of ankylosing spondylitis is very important. Regular treatment helps to achieve better disease control and prevents progression to the next stage. Patients will experience less flares due to steady state of control of inflammation. Treatment can help to stop spread of inflammation to other organs like eyes and blood vessels. Thus, regular treatment helps to reduce risk of complications related to inflammation in blood vessels, like patients are at risk of getting heart attack at young age due to the higher cardiovascular risk. Regular treatment and follow-up with rheumatologists helps you to track your symptoms and upgrade medications if required. After adequate symptom control, the focus during your follow-up visit shifts to improving quality of life and address extra spinal issues like osteoporosis. How long should I continue medication? This is a common question asked by our patients. So, in diseases like malaria and typhoid, which most patients are familiar with, there is a definite period of treatment. However, in chronic conditions like ankylosing spondylitis, there is no upper limit. The duration of treatment is decided on an individual basis. Some patients go in drug-free remission, means they do not need any medications and their disease is quiet, and this can happen for years. During follow-up, we watch out for recurrence or extraspinal manifestation. We should be clear about our goal in treating ankylosing spondylitis. So, goal is not to stop medication. Main goal is you should be able to lead a normal life. For this goal, you will have to take medication for a long time with regular monitoring. Rheumatologists will take all precautions to avoid side effects and change medications if required. I ask my patients to prepare their mind for minimum 2 to 3 years of continuous treatment. This can have disease modifying impact. Patients are often curious to know whether their treatment is working or not. Remember, there is no single parameter to know whether your treatment is working or not. Patients responding well to treatment report significant improvement in their pain and stiffness. Their ability to perform activities of daily living with treatment improve. Many patients' family member notice the improvement in their posture as well. So blood reports like ESR and CRP can show reduction in their numbers. However, they may lag behind or they may be high due to some other causes. So there is no single parameter, or do not get stick only to ESR or CRP levels. Improvement in fatigue and sleep quality is often reported by patients who are doing well on treatment. A physiotherapist can help in objectively verify the improvement in range of motion of your spine and the other joints. They can help you to track yearly the improvement in the range of motion of your spine. So diet is an important topic. Most patients are interested in knowing about this. So balanced diet is important to improve general health and control weight. I advise patients to avoid pro-inflammatory foods like sugary food or bakery products. Anti-inflammatory foods like nuts or green leafy vegetables can help many patients. But you can always seek professional help from a qualified dietitian in finding out the customized diet plan for you. A healthy diet should consist of whole grains, vegetables, and fruits. Certain nutrients such as omega-3 fatty acids can reduce inflammation. You should try to limit sugar and salt intake. Avoid processed foods containing trans fats. You should limit alcohol intake, and you must quit smoking. Sour foods like lemon, tomato, vegetables like brinjals are important sources of essential nutrients. Many myths, due to many myths, patients advise patient avoid these important food items. Malnutrition makes joints and muscles weaker, which makes arthritis treatment even more difficult. Being overweight is a major risk factor for osteoarthritis and heart disease. If you are overweight, losing weight can reduce that risk. Hence, you should consult a dietitian to get a balanced diet for your weight management and management of inflammation related to ankylosing spondylitis. Though we know we should exercise regularly, however, many are not aware that there are certain do's and don'ts while performing the exercise routine. First important one is you should work with a physiotherapist. A skilled physiotherapist can help to create exercise routine tailored to your specific needs. You should make time to exercise every day. So I tell my patient consistency is more important than the type of exercise you do. You should aim for 20 to 30 minutes of exercise every day. Don't just do one form of exercise. We can't change the spine. However, we can definitely change the exercise routine. And the variety in the exercise can help you to continue exercise on daily basis. So do not do movements that causes pain. You should know your limits. Any exercise that requires you to twist your spine too much or that stresses too much on your back and spine could cause problems. High impact exercises such as running or twisting sports like tennis can increase pain in the spine, hips, or the knees. You should focus on good posture while exercising. Standing straight against the wall can help you to know about your posture. I often advise patients to have a mirror in front of them when they are exercising, and don't overdo. Every day is different, so you need a different plan for that time when your disease is in flare. Last one, do stick with it. Continuity is more important than the quantity or the type of exercise. Daily exercise routine with the help of physiotherapists can help you to fight this ankylosing spondylitis. Also, exercise provides pain relief and better quality of life. Strong muscles ease pressure on the joints in your spine, and the range of movement exercises helps to relax muscles that have tightened due to inflamed joints. Thus, stretching exercises reduce the pain in your muscles. Several studies have proved that regular exercise is associated with lower disease activity and better daily functioning. Exercise helps with increasing your flexibility and range of motion. Stiffness makes you not want to move. If you don't move, you lose flexibility. Exercise may seem unappealing or even dangerous when you are in pain and you have stiffness. But people don't exercise may experience more fatigue and pain because lack of movement leads to decreased joint motion, stiffness, and muscle weakness. Range of motion or stretching exercises can reduce stiffness and ensure that your muscle and joints maintain a close to their full range of motion as much as possible. They are crucial for ankylosing spondylitis because people tend to limit movements in areas where there is a swelling or pain, which can lead to loss of mobility and increased risk of joints that will fuse eventually. Exercise also helps to keep healthy weight and reduces fatigue. Researchers have found that obesity is linked with greater inflammation and it is linked with higher disease activity. Also, obesity is a greater risk for wear and tear in the large joints like knees and hips. Researchers have found that in a group of 60 patients with AS, those were assigned to postural re-education or conventional exercise program, or and the other group who took biologics therapy. So they had lower fatigue scores if they were having exercises and biologics therapy in combination. Also, these patients reported improvement in disease activity, sleep quality, and depression scores. Exercise helps to create a greater lung capacity. Some people with ankylosing spondylitis lose flexibility in their spine. In severe cases where two or more vertebrae fuse together, the movement of the rib cage and the lungs may be restricted. Every time you breathe, the ribs move forward as the diaphragm moves down. With ankylosing spondylitis, those forward movements of the ribs can become limited. This can prevent the lungs from expanding fully to take oxygen, increasing the risk of restrictive lung disease. So, deep breathing exercises and aerobic exercises like walking, jogging may help to maintain the flexibility in your chest and increase the lung capacity. Exercises enhances the effectiveness of medication. So when patient should not exercise? When it comes to AS, exercising, no gain, no pain philosophy is the wrong approach. Low or no impact exercise such as yoga, swimming, walking or cycling are the best for people with joint pain. Protecting your joints while being physically active is the key consideration for people with AS. Exercise safely with tips below. 1. If you feel stiff or sore prior to your workout, a hot bath or a shower may help ease your joints. Second, exercise when you feel most awake or you are in the least amount of pain. Stop exercising if you are in pain. A patient recently asked me whether he should take a painkiller prior to exercise. If exercise is that painful, which requires you to take a prior painkiller, it means you are doing it wrong or the exercise is not suitable for you. Be careful not to take too much pain medication immediately before exercise, as it can make it hard for you to determine whether you are in pain or not. Know your limits and discuss with your physiotherapist before defining your exercise routine. So we are going to discuss about the different types of exercises recommended for patients with ankylosing spondylitis. So first one is range of motion or stretching exercises. These type of exercises are done without weights to move the muscles and joints through their full range of motion. They are often done as a warm-up exercise before the sports. It is recommended that range of motion or stretching exercises be done daily for all joints that are stiff or that have the potential for becoming stiff. The next one is aerobic or cardiovascular exercise. Low impact cardiovascular exercises such as walking or cycling are great for joints health, but few exercises are widely recommended for AS such as aquatic activities like swimming or water aerobics. Water offers an anti-gravity environment that is easy on your joints, and the pool provides gentle resistance to help you comfortably build cardiovascular health. Aerobic exercises improve heart and lung function and the overall health. Studies shown that people with spondyloarthritis who do aerobic exercises have better breathing function, endurance, and mood, less disease activity, pain, and fatigue than compared to those people who do not exercise. The current aerobic exercises recommendation include 20 to 30 minutes of aerobic exercises 3 to 5 times a week. Next type of exercise is the strengthening exercise. These exercises use your muscles to move or hold against a weight or resistance. You don't have to lift heavy weights to effectively strengthen your back muscles. Light hand weights and resistance training using your own body weight, for example in yoga, are effective. Yoga's spinal flexibility exercises use isometric training, that is, you strengthen muscles while holding position rather than moving between different positions to increase range of movement. Some of the most important muscles to strengthen in ankylosing spondylitis are the core muscles, which are the abdominal and back muscles that supports your spine. Having strong core muscles have been shown to reduce stress in the spine, and therefore it can minimize the back pain. As such, core strengthening is the key in managing your back pain. Strengthening exercises should be performed 2 to 4 times per week for the best results. So next form of exercise is the balance exercise. Focus on improving your stability when you are still and moving. These exercises are especially important in patients who are less active and are of age. A balance exercise can help to reduce chances of falling, and which is especially important for people with lower bone density. Thus, it reduces the risk of fracture during the fall. By working with your physician and a physiotherapist, you can set realistic goals for yourself. Choose exercise and physical activities that are safe, enjoyable, and stay with your program that optimizes your health. The last but not the least is the breathing exercises. These movements may not cause you sweat, but they are invaluable at maintaining the flexibility in your ribs. and they keep your breathing easy. Breathing exercises are a great way to begin and end your workout. While at workplace, a comfortable chair is very essential. Look for a chair with lumbar support that can be adjusted to your needs to make your workday less strenuous on your joints. Make sure your chair can sit you in a variety of comfortable positions, whether upright or semi reclined. Having a chair with a headrest and adjustable armrest is also wise. Ideally, your upper and lower arm should make a right angle so your wrist can stay straight while you use your computer. Second important consideration for your workstation is having a standing desk. Even with the most comfortable chair in the world, sitting all day can be uncomfortable. That's where a standing desk can come in handy. You should protect your eyes when working with screen. AS mainly affect the spine, but sometimes patients with ankylosing spondylitis can have inflammation in the eyes. And that's why the next key hack for your work day is to take regular screen breaks. Even eye fatigue from screen can be problematic for AS patient. So taking frequent screen breaks is important. A good guideline is 20-20-20 rule. Every 20 minutes, look away from the screen at an object which is 20 feet away for 20 seconds. This basically helps your eye muscles to relax because they are in a fixed viewing position all day long when you are looking at your screen. Fourth important hack is find the right position for your screen and keyboard. Properly positioning the computer screen and keyboard is important with AS. Your eyes should be at the level with the top of your computer screen. If you have to tilt your head to look up or down at your screen, it can put undue stress on your neck and the back. A keyboard tray can also help you to sit in optimal semi-reclined position so you are not reaching so far from your body to type. But if you are using a laptop, often laptop screens will be too low, so you will need a raise for your laptop to reach to the optimal eye level. You can use a stack of books or buy a laptop riser for this purpose. So don't stay desk bound for too long. Taking frequent short breaks to move around is another easy but important hack for getting through the workday with AS symptoms. Make sure you are putting breaks into your schedule so you can stretch and loosen your joints. We learned earlier that sitting for a long time can lead to accumulation of pro-inflammatory proteins, and that's why you get stiffness. So when you are inactive, the inflammation sets in, and when you try to move, it affects your mobility. So that's why it is important to tune into these early signs of pain and change to a different position as soon as you notice discomfort. Even a small adjustment in your position can make a big difference. Even if you are just getting up for 2 minutes to grab a glass of water, that adds to getting better full body circulation. Movement helps to deliver fresh, oxygenated blood throughout your body. You should practice good body mechanics. So far, most of these hacks have been about modifying your work environment so you can function better within it. But being mindful of how you are using your body and to interact with your environment is also important. Pay attention to your body positioning. Setting up an alarm every 30 minutes or so on your phone or computer as a reminder to check your posture can help to build this habit. Additionally, working one-on-one with your occupational therapist or a physiotherapist can help to learn whether there are specific adjustments you can make to your body movement or a posture to help to reduce the AS pain symptoms. So the bottom line on modifying your work day for AS is while some of these hacks may seem simple changes, they can add up to make big impact on your day-to-day life. Don't hesitate to get ergonomic assessment of your workstation done by a qualified occupational therapist. They can make personalized recommendations to help to address your unique challenges and make your workplace better and AS friendly. You might be able to do more that you feel is possible by simplifying your daily work, taking different approaches, and using different tools. Making changes to your workstation has been shown that it improves the productivity of these patients. The important advice I would like all our patients to remember that you are not alone. You should join hands with patient support groups like Ankylosing Spondylitis Welfare Society. Together, we can beat this disease. Keep yourself updated on the latest information by the channels provided in the link below.